Hiccups are common in life and normally they are of brief episodes. Hiccups may be produced due to repeated muscle contractions or sudden movements of the diaphragm that results in a hic sound. An episode of hiccups may last more than a few minutes and they are self-controlled. They may occur around 4 to 30 times per minute. However, prolonged attacks may need medical attention. When they last longer than 48 hours, they are called protracted hiccups. In such conditions, they should be carefully monitored and may need medical attention. When the hiccups last for greater than 1 month, they are called intractable hiccups. Even the exact reason for the development of hiccups is not clear. Few risk factors may induce protracted hiccups. Eating a large meal or intake of carbonated beverages may induce hiccups. People with gastroesophageal reflux may have uncontrolled hiccups. Chronic alcoholism may be another reason for developing this condition. In such people, an acute alcohol intake may suddenly develop attacks of hiccups. Insomnia may be another reason. People with insufficient sleep cycles, difficulty sleeping may also develop hiccups. Emotional distress may also induce this condition. People with cardiac arrhythmias may have sudden episodes of syncope and this may trigger attacks of hiccups. Many of the times hiccups are managed by non-pharmacological methods. But based on the severity of the conditions, they may require few medications. So in this video, we are going to cover such types of medications that are indicated for treating hiccups. First one is antipsychotics. Among the antipsychotics, Chlorpromazine is a drug of choice for treating hiccups and it is approved by FDA. It is a dopamine antagonist that blocks the dopamine receptors at mesolimbic and mesocortical pathways on the postsynaptic receptors. This medication is also having anticholinergic effects. It can also depress the reticular activating system and it also blocks alpha adrenergic receptors. Due to multiple mechanisms, Chlorpromazine is effectively reducing the hiccups in the people. This medication can be given at a dose of 25 to 50 mg by intravenous or intramuscular route. Haloperidol is also useful in the treatment of irregularities in muscle movements. It blocks mesolimbic dopamine D1 as well as D2 receptors in the brain. It is effective at dose of 2 to 5 mg for treating hiccups. Second category is a proton pump inhibitors. Gastroesophageal reflux disorder GERD is a condition of increased reflux of gastric acids into the esophagus. Even though it is not common, in a few people, GERD may be associated with hiccups. Normally, by intake of large amount of meal, hiccups may be produced. But in people with GERD, even with a moderate amount of eating, it may induce gastroesophageal reflux, which can induce the development of hiccups. Therefore, in such people, gastric acid should be controlled by using proton pump inhibitors. Taking smaller amounts of meals and avoiding eating before bed may also reduce the attack of hiccups. Proton pump inhibitors reduce gastric acid secretion and relieve the symptoms of GERD. Medications like omeprazole, pantoprazole, and lansoprazole can be used to control hiccups associated with GERD. They selectively block proton pumps on the gastric parietal cells and inhibit gastric acid secretion. They also improve GI motility. They have few advantages. Particularly, these medications are safe and not producing troublesome side effects. They produce long-lasting effect on gastric acid secretion and relieve the symptoms rapidly. Third, they can be combined with other medications. So because of these advantages, proton pump inhibitors can be widely used to control hiccups in the people with GERD. Third category of medications are antiemetics. Metoclopramide is a prokinetic agent that works as an antiemetic. It increases the GI motility and reduces gastric emptying time. It acts as a dopamine receptor antagonist. It reduces nausea and vomiting in people with GERD. It also reduces hiccups by improving GI motility. It can be used either alone or in combination with proton pump inhibitors. It can be given at a dose of 10 mg for every 8 hours. Next one, anticonvulsants. Anticonvulsants like phenytoin, valproic acid, and carbamazepine are effective in treating intractable hiccups. Phenytoin is one of the medications that can be used as an anticonvulsant. It can also be used to control hiccups. It can reduce the spreading of motor activity by inhibiting the neuronal activity at the motor cortex. Valproic acid is another medication that has multiple mechanisms. It increases the levels of GABA, gamma-aminobutyric acid in the brain. It also affects the potassium channels, and it can even block voltage-gated sodium channels. By these multiple mechanisms, valproic acid can control hiccups in the people. Carbamazepine is another agent that is again used to treat hiccups. Another anticonvulsant is the gabapentin. It works by blocking voltage-gated calcium channels. It is again effective in treating hiccups in people with CNS lesions. It can be used at a dose of 300 mg given thrice daily. Next one is the anesthetics. Ketamine is one of the IV anesthetic which is also used to control hiccups. It is going to act on the cortex and limbic system and decreases the muscle spasms. It is given at a dose of 0.4 mg per kilogram of the body weight. Lidocaine is a local anesthetic that can reduce the activity of sensory neurons. It can inhibit the depolarization of sensory neurons by blocking sodium channels. It can be given at an infusion rate of 2 mg per minute along with a loading dose to control hiccups in the people. Next one, muscle relaxants. Baclofen may induce hyperpolarization of efferent terminals, and it can inhibit the synaptic reflexes at the spinal cord. By reducing the synaptic reflexes at spinal cord level, it can produce muscle relaxation. Therefore, it is useful in the treatment of hiccups in the people. However, this medication is having one advantage. This medication is not excreted in the urine. Therefore, it is suitable in the people with any renal impairment. Therefore, baclofen is used in the people with renal impairment where other medications are contraindicated. Baclofen can be given at a dose of 10 mg orally for every 6 hours. Orphenadrine is another muscle relaxant that is also used in treating hiccups. Finally, let us see the other types of medications. Analgesics like morphine can also be used. It is one of the drug of choice for producing analgesia centrally. This medication can induce a sedation as well as it can reduce the hiccups in the people. Another category of medications are the sedatives and hypnotics. Chloral hydrate can have a depressant effect on the central nervous system, so it can be used to control the hiccups in the people. However, benzodiazepine should not be used for treating hiccups. Benzodiazepines are also used as sedatives and hypnotics. However, they can increase or even they can precipitate the hiccups in the people. Therefore, these medications should be avoided for treating hiccups. Next one is the antidepressants. Tricyclic antidepressants like amitriptyline can be used. They inhibit the uptake of serotonin and norepinephrine in the postsynaptic neurons. Stimulants like ephedrine can also be used. It produces sympathetic activation and induces stimulation in the CNS. Methylphenidate is a centrally acting muscle relaxant. It is a neurostimulant. It can inhibit the uptake of dopamine and norepinephrine, thereby it can produce muscle relaxation. Since it produces muscle relaxation, it can control hiccups in the people. These are the various types of pharmacological treatments for treating hiccups. However, this list is not complete. Still, many medications can be used. However, the type of medication that is used depends on the severity as well as the underlying conditions of the patient. In people with renal impairment, baclofen may be preferred. Chlorpromazine is a drug of choice which can be given by intravenous or intramuscular route. In the people with GERD, proton pump inhibitors can be given along with any antiemetics. And for intractable hiccups, muscle relaxants or anesthetics like ketamine can be given. All these pharmacological methods are useful when these hiccups are not resolved even after 48 hours, where they need medical attention and proper treatment. So that's all about the different medications that are used to treat hiccups in the people. I hope this video is useful to you. If you really like this video, please subscribe to our channel, share this video with your friends, post your comments in the comment box, and hit the like button if you really like this video. Thanks for watching. See you in the next video.